Hello, dear students. I'm Dr. Gaurav Agnihotri, and today I'm going to talk about the human mandible. So this mandible is frequently asked in the examinations, whether it is the dental examinations or the medical examinations. And the students also prefer this bone because they find it easier to remember compared to the other bones. So let's see. The name itself, mandible, this is a bit surprising because it's present in females also. So why should it be called the mandible? Actually, in Greek language, the word mandir means to masticate or chew. So the origin of this word mandible is from the Greek word mandir, which means to masticate or chew. So anatomical terminology is derived from Greek language. And also in Latin language, mandibula means lower jaw. So the mandible, now you can make out why it is called the mandible, because the word mandir in Greek language means to masticate or chew, while the word mandibula in Latin language means lower jaw. Okay. So this bone, it's a U-shaped bone. You can make out it's a U-shaped bone, and this bone has got a body. This is the body of the bone, and this is the ramus. Right. So two rami are there, and this is the body. So this body, let's talk about this body first. This body has got an external surface and an internal surface, right? This is the internal surface of the body, and this body has got an upper border or alveolar border and the lower border or base of the mandible. So let us talk about the external surface of the body of mandible. So I'll just bring this mandible close to the camera here. So in the midline, there's a ridge here in this region. It's a faint ridge known as symphysis mentae. So this symphysis mentae is there, and below this symphysis mentae is a protuberance referred to as the mental protuberance. So this is characteristic of the human mandible. So in the midline of the body, you have two things which you have to keep in mind. One is symphysis mentae, which is a faint ridge in this region, and one is this triangular area. So there's a triangular area here extending from the lower aspect of symphysis mentae and going on like this. And on the lateral angles of the triangular area are the two mental tubercles, this one and this one. So this mental protuberance is characteristic of the human mandible, right? So these are the two mental tubercles. And then there is this mental foramen here. So we'll mark it as 1. You remember 1 because the mental nerves and vessels, they come out of the mental foramen. So in the end, what we'll do is we'll try to recapitulate which nerves and vessels are in relation to the mandible. So one is mental nerves and vessels come out of the mental foramen. So then here is the incisive fossa below the incisors, incisive fossa. So here lies the muscle mentalis and the orbicularis oris. So mentalis, when in doubt, move the mentalis. See here, mentalis. So it lies in relation to the incisive fossa. And then there is this ridge which passes. It's a faint ridge which is passing from the lower aspect of the anterior margin of the ramus, and it is going down up to the mental tubercles. So this ridge is called the oblique line. So from anterior to posterior, which muscles are attached to the oblique line? Well, they are depressor labii inferioris, which will move the lower lip downwards, depressor anguli oris, so it will move the angle of the mouth downwards, and then the buccinator muscle below the molars. So buccinator muscle, it prevents accumulation of food in the vestibule of the mouth. Yes, so oblique line has got some attachments to it. So let us recapitulate the structures we have seen on the external aspect of the body of the mandible. We have seen symphysis mentae, mental protuberance, then mental tubercles, mental protuberance, mental tubercles. Then we have seen the mental foramen, incisive fossa, and we have seen the oblique line. Yes. So these are the structures on the external aspect of the body of the mandible, external surface of the body of mandible. Now we come to the internal surface of the body of mandible. And here the most prominent feature is this line. This line is called the mylohyoid line. So it is extending from behind the third molar tooth, and it is going downwards towards the midline between the two digastric fossae. These are the two digastric fossae for the anterior belly of digastric muscle. So this mylohyoid line gives attachment to the mylohyoid muscle, and the mylohyoid muscles of the two sides, they unite to form a partition here. So on the internal surface of the body of mandible, the characteristic feature is this mylohyoid line. Now behind the posterior end of mylohyoid line here is the fossa for the submandibular salivary gland. So what lies here? Submandibular salivary gland, some mandibular lymph nodes, and then facial arteries lying here. It is important to understand here that when we look at the external surface, junction of ramus with the body, here lies the facial artery and facial vein. So if the two prongs of my forceps I keep like this, then the anterior one is facial artery, posterior one is facial vein. A for artery, artery is anterior. So that facial artery also lies here in the submandibular fossa on each side. So we are talking about the internal surface of the body of mandible. We have done the mylohyoid line, we have done the submandibular fossa. Then in relation just above the anterior end of the mylohyoid line, here lies the sublingual fossa. Here lies the sublingual salivary gland. Okay. Then the mylohyoid line is going towards the center between the two digastric fossae. And just above this mylohyoid line, you find some tubercles here. These are called genial tubercles on either side of the midline. These genial tubercles are for the genial muscles. So they are for the genioglossus and geniohyoid muscles. And glossus means tongue. Hyoid bone is here lying at C3 level. So since the tongue is at higher level compared to the hyoid bone, so the upper genial tubercle is for the genioglossus muscle, while the lower genial tubercle is for the geniohyoid muscle. So let us recapitulate the structures we have done on the internal surface of the body of mandible. Well, we started with the mylohyoid line, then we came to the submandibular fossa, sublingual fossa for the submandibular and sublingual salivary glands respectively. We did the genial tubercles for the genial muscles, upper genial tubercle for genioglossus muscle, and you're very right, lower genial tubercle for geniohyoid muscle. Then this mylohyoid line, it is starting from behind the third molar tooth, and it is lying 1 centimeter below the alveolar border. That is the upper border of the mandible where the sockets of the teeth are located. So if I make you see on this side, so this is the mylohyoid line, and this is the molar tooth you see here. So this mylohyoid line is going up like this. So behind the third molar tooth and above the mylohyoid line, you have got two structures here, superior constrictor muscle and pterygomandibular raphe. Yes. So between the superior constrictor muscle and mylohyoid line lies the lingual nerve. So this is a very important question asked in Viva examinations. Where is the location of the lingual nerve? So we can mark it as two here now. One was mental nerves and vessels. Okay, nerves and vessels in relation to the mandible. So here we say that the lingual nerve is located between the upper end of mylohyoid line and the origin of superior constrictor muscle. So this is the area of the where the lingual nerve is related to the mandible, right? So this is another aspect. So as far as the internal surface of the body of mandible is concerned, there are six structures which you must keep in mind. So let us recapitulate: mylohyoid line, submandibular fossa, sublingual fossa, then at 4 number genial tubercles, then origin of superior constrictor muscle and pterygomandibular raphe. Yes, and relation of lingual nerve, you should also know. So this was about the internal surface of body of mandible. Now, upper border of body of mandible, well, it has got sockets for the teeth. Yes. Lower border of body of mandible is also called base of mandible. So here, if we start from inside, here you have got the two fossa, digastric fossae for the anterior belly of digastric muscle. To the base of mandible is attached the investing layer of deep cervical fascia. Yes. And on the outer aspect of the base, here you've got the attachment of the platysma muscle. Platysma muscle. Yes. So this was about the borders of the body of mandible. So we have done the external surface of the body of mandible, internal surface of the body of mandible, upper border of body of mandible, and lower border of body of mandible. So which structures have we seen? Let us recapitulate them. Okay. So external surface of the body of mandible, we did the symphysis menti, we did the mental protuberance, we did the mental tubercles, we did the mental foramen, we did the incisive fossa, we did the oblique line. Yes. And internal surface, we did the mylohyoid line, submandibular fossa, sublingual fossa, genial tubercles, and then origin of superior constrictor and pterygomandibular raphe, and then relation of lingual nerve. We did the upper border and we did the lower border. And of course, we did that at the junction of body and ramus on the external surface. You've got the facial artery anteriorly and the facial vein posteriorly. So this completes the body of mandible. Now we come to the ramus of mandible. Now this ramus of mandible has got an anterior border, posterior border, superior border, inferior border. It has got a lateral surface and a medial surface. So lateral surface is for the prime minister. P stands for parotid gland and M stands for masseter muscle. Masseter is one of the muscles of mastication. So if I divide this lateral surface into 4 parts, then the posterior superior area, so which will be the posterior superior area? That is the one which is lying posteriorly and superiorly, this one. Posterior superior area is the one which is related to the parotid gland, while the remaining part of the lateral surface is related to the masseteric muscle, a very strong muscle of mastication, masseteric muscle. So lateral surface is for the prime minister. P standing for parotid gland, which is related to the posterior superior area, while the remaining area of the lateral surface is related to the masseter muscle, which is a muscle of mastication. So muscles of mastication are also attached to the mandible. So we have done one muscle of mastication, that is the masseteric muscle. Then, so this was about the lateral surface. Now we come to the medial surface of the ramus of the mandible. So here lies the muscle on the lateral surface, masseter muscle, a very strong muscle. Yes. Now we come to the medial surface of the ramus of mandible. And here on the medial surface of the ramus of mandible, what do we see? So in the medial surface, in the center, we see mandibular foramen, okay, which leads to the mandibular canal. So there's a foramen here in round about its center, just above the center, and now the forceps is into the mandibular canal. Yes. So what happens is that the inferior alveolar nerves and vessels, they enter the mandibular canal through the mandibular foramen like this. And then when they come, they supply the teeth, and then when the inferior alveolar nerves, they come out through the mental foramen, and then we call them the mental nerves and vessels. Yes. So 3, you remember 3. 1 was mental nerve, 2 was lingual nerve. You remember 3, point number 3, that the inferior alveolar nerves, they enter the mandibular canal through the mandibular foramen, and then these inferior alveolar nerves, they supply the lower teeth, and then they come out as mental nerves through the mental foramen. Yes. So this was point number 3. Now on the medial surface, we have done the mandibular canal and the mandibular foramen. So just anterior to the mandibular foramen is a tongue-shaped projection, this one, in relation to the anterior margin of the mental foramen is a tongue-shaped projection, which I'll mark here. This tongue-shaped projection is called the lingula. Lingula. In relation to the anterior margin of the mental foramen lies the lingula. And this lingula, what is attached here? Sphenomandibular ligament is attached to the lingula. So sphenomandibular ligament is attached to the lingula, which is a tongue-shaped projection in relation to the anterior margin of the mandibular foramen. So you remember this thing. Then there's a groove here. It's called mylohyoid groove. This mylohyoid groove is present on both the sides. You can make out here also mylohyoid groove. This is the mandibular foramen, and here you can see the mylohyoid groove extending in relation to it. So this mylohyoid groove is for the mylohyoid nerves and vessels. So you can remember it as 4. The fourth nerve or vessel in relation to the mandible, mylohyoid groove for the mylohyoid nerves and vessels. And below the mylohyoid groove, this area shows roughening, and this roughening is because of attachment of medial pterygoid muscle here, which is a muscle of mastication. So on either side, you've got the mylohyoid groove, and below the mylohyoid groove, you see these rough patches, they are due to the medial pterygoid muscle getting attached here. Okay, so medial pterygoid muscle is another muscle of mastication. The first muscle we did was the masseter muscle. And then the second muscle we do for mastication is the medial pterygoid muscle. So it is attached on the medial aspect of the ramus of mandible. Then anterior border of the ramus of mandible. Anterior border of the ramus of mandible is there. And this anterior border of the ramus of mandible gives insertion to temporalis muscle on the anterior aspect and also on the medial side. So temporalis muscle is a muscle of mastication, which is getting attached on the anterior border of the ramus of mandible and also the coronoid process anterior border. So this is the anterior border of the ramus of mandible. Superior border of ramus of mandible presents the masseteric notch, and for this you remember 5 now. Masseteric nerves and vessels pass through the masseteric notch. Posterior border of ramus of mandible is related to parotid gland. Yes. And then the inferior border of ramus of mandible is a continuation of the base of the mandible, and it becomes the angle of mandible here. Yes. So this was about the borders of the mandible. So ramus, what all structures we have done? Ramus, we have done lateral surface, medial surface, anterior border, superior border, posterior border, and inferior border of ramus. Now we come to the coronoid process. Coronoid process lies above the anterior border of ramus, and here also, just like the anterior border of ramus, the temporalis muscle is attached on the anterior aspect, apex, medial margin. So temporalis muscle is there. And then this is the condylar process. Condylar process has got an upper expanded portion and then a narrower lower portion. This upper expanded portion is for articulation with the temporal muscle to form the temporomandibular joint, while this lower narrow portion is called the neck. On its lateral aspect is attached the capsule of temporomandibular joint, and anterior aspect presents a depression which is called pterygoid fovea. Now this pterygoid fovea is for the insertion of the lateral pterygoid muscle, another muscle of mastication, lateral pterygoid muscle. So how many muscles of mastication we have done? Main muscles of mastication, we have completed the 4 main muscles of mastication. So let us recapitulate. Where was the masseter muscle located? on the lateral surface of the mandible, except the posterior superior area, which was related to parotid gland. Where was the medial pterygoid muscle? For it, we have got these ridges here on the medial aspect of the ramus below the mylohyoid groove. Where was this temporalis muscle? Temporalis muscle is on the anterior border of the ramus of mandible and the coronoid process and the medial aspect. Also apex of coronoid process. Insertion of temporalis muscle. And pterygoid fovea, this depression here in front of the neck of mandible, here is inserted the lateral pterygoid muscle of mastication. So, what all nerves we have done in relation to the mandible? What all nerves we have done in relation to the mandible? Mental nerves and vessels, lingual nerve, inferior alveolar nerves and vessels, mylohyoid nerves and vessels lying in the mylohyoid groove, masseteric nerves and vessels passing through the masseteric notch. And now we do that on the medial aspect of neck of mandible are related to structures, auriculotemporal nerve above and maxillary artery below. So if I show this two prongs of this forceps, the upper one is representing the auriculotemporal nerve, while the lower one is representing the maxillary artery. So auriculotemporal nerve and maxillary artery you remember as 6 and 7. So these 7 structures are lying in close relation to the mandible. Yes, so students, now we have done most of the mandible. Now we do its ossification. Now ossification of mandible is important because the mandible ossifies both in membrane as well as cartilage. So on the lateral aspect of the Meckel's cartilage, there is a sheath that forms the membrane, and a center appears in the 7th week of intrauterine life in that membrane. And the parts of the mandible which ossify from cartilage, there are 4 parts of mandible which ossify from cartilage. You remember them as 4 C's. C stands for coronoid process, condylar process, cranial part of ramus above the mental foramen, cranial part of ramus, and chin part of body of mandible. So these are the 4 C's from which ossify from cartilage. So I'll repeat them, that mandible ossifies from both membrane as well as cartilage. On the lateral aspect of Meckel's cartilage is the membrane sheath, membranous sheath, from where membranous ossification starts. A center appears there in the 7th week of intrauterine life. And the parts of the mandible which ossify from cartilage are the 4 C's: coronoid process, condylar process, chin part of body of mandible, and cranial part of ramus above the mental foramen. Okay, so this is about the ossification of the mandible. Mandible is also an important bone for odontologists, for forensic experts, because age can be determined from the mandible. So age determination of mandible is important. So how do we determine the age of the mandible? Well, we can make out from the mandible whether the mandible belongs to a young person, it belongs to an adult person, or it belongs to an old person. So younger the person, the mental foramen will be towards the lower border or base of the mandible. In adults, it will come to lie in the middle of the body of mandible, and as they grow old, this mental foramen will come near the alveolar margin. So actually what happens is that there is resorption of the alveolar border with aging. So that due to that resorption, it appears that the mental foramen is moving up with age. Actually, it's not moving up with age, but from the mandible, we can make out if the mental foramen is roundabout in the center, we say it's a mandible of the adult. Okay. Then another thing is that the angle of mandible. Angle of mandible is 140 degrees in children, and so it will be like this. It will be 140 degrees in children and old age, while it is 110 degree in adults. So 110 degree, this is 90 degree. Okay, this is 90 degrees, 110 degree in adults and 140 degree in children and old age. So this angle of mandible gives us an idea. If it is less than 120 degree, we say it's an adult mandible. If it is round about 140 degrees, we say that the mandible is either that of a child or an old person, right? So two things we have talked about regarding age determination. One is mental foramen, other is angle of mandible. Then this condylar process is above the coronoid process at a higher level compared to the coronoid process in adults. Condylar process is at a higher level compared to coronoid process in adults, while the coronoid process is at a higher level in children and in old age. Because this neck of the mandible with the aging, the angle becomes more obtuse, and so the coronoid process condylar process it lies at a lower level compared to the coronoid process in old age. So another feature is one can grossly make out the age by looking at the number of teeth present on the mandible. If the number of teeth are less, that means they have fallen off. That means that it is more likely that the mandible is that of an old person. Now this mandible which I am holding in my hand, you can make out that the mental foramen is lying a little above the center. Teeth are not there. And if I look at the coronoid and condylar processes, it appears that the coronoid process is slightly higher compared to the condylar process. So this is most probably the mandible of a middle-aged person. Adult age has passed, and old age probably has not fully set in, but definitely more than adult and less than old age. So this is how we do the age determination from the mandible. So I recapitulate the three things: that as a person ages, the mental foramen moves towards the alveolar border. In children as well as in old age, the angle of mandible is 140 degrees, while in adult it is 110, 120. And then the condylar process is at a higher level compared to the coronoid process in adults, while the coronoid process is at a higher level than the condylar process in children and in old age. So this was about the mandible, and this is an important class, and it's been a while since I've been taking this class, because I completed the remaining portion of osteology earlier. So I am now happy that I finished this portion, the mandible, completed this portion today with you. So thank you for your time and cooperation. Have a nice day. And any comments you want to say, make about the class, you can make it in the inbox. Thank you.